If you're a 401k millionaire with 2 million or more saved and you're thinking about retiring before age 65, there's really one thing that could really potentially derail your plan, and that's not the stock market, it's not taxes, it might just be healthcare. I call it the government playbook. You know what I'm talking about. Wait until you hit a certain age, like 59 and a half, 62, 65, and let those dates really dictate what you can and can't do. As if your entire retirement system should revolve around when Uncle Sam says you're allowed to access your money or when you're able to get healthcare coverage. Now, here's what most people don't realize is most thinking turning 62 is all about Social Security, but like, what if you're retiring early? It's really about healthcare because you're not eligible for Medicare until 65, and these 3 years between retirement and Medicare eligibility can be some of the most expensive and the most confusing years of your entire plan. Today's video, I'm going to break down some of the biggest mistakes from a healthcare perspective that I see 401k millionaires make when retiring early and exactly how to avoid each one, because the truth is healthcare does not need to be a barrier to early retirement. It is the most common thing I hear keeping people locked into the government playbook working until age 65 when really they might not have to. I'm Kyle Hammerschmidt. I'm the founder of MOKAN Wealth. At MOKAN Wealth, we help self-made 401k and IRA millionaires keep more and pay less in taxes. So let's make sure healthcare doesn't cost you years of your life you'll never get back. So the first mistake is just really underestimating the true cost of individual health insurance. If you imagine a scenario here where you're 62, you just retired or getting ready to retire, you're shopping for health insurance for the first time in decades, you pulled up the ACA marketplace website, you see a silver plan for $700 a month, not bad, right? That's $8,400 a year. But here's what most people miss. That $700 premium is just the beginning. The average monthly premium for a 62-year-old on that silver plan is approximately closer to about $1,300 per month in 2025. For a couple both 62, you're looking at anywhere from $1,400 to $2,400 per month without subsidies. That's about $16,000 to $28,000 per year just in premiums. But the premiums are only part of the story. Most of the silver plans come with deductibles like $5,000 per person, which means you're really paying that premium every month. And then you're still paying the first $5,000 of medical expenses out of pocket before insurance even like kicks in. And then those out of pocket maximums. So if you look at ACA in 25, that's like $9,200 per person or $18,400 per family. If you're a spouse, have health events like a surgery, hospitalization, ongoing treatment for chronic condition, you could hit that maximum. So let's do the math for a hypothetical couple, both 65, paying full price without subsidies. Here's what this would look like. Annual premiums, $20,000 to $25,000, and then deductibles and co-pays about $3,000 to $6,000 for routine care. So annual cost, $23,000 to $31,000. That's about $69,000 to $93,000 over those 3 years before Medicare kicks in. This is for people in generally pretty good health. Now, I'm not saying this to scare you. I'm saying this so you plan for it, because the biggest mistake I see people is budgeting $12,000 a year for healthcare, and then reality, they're spending double that. And then suddenly they're questioning whether, well, should I have even retired at all? I wasn't planning for this. The cost also varies significantly by the state. If you're in a state with a robust marketplace competition, your cost might be lower. But if you're in a rural area or a state with limited insured participation, you could be paying substantially more than these national averages that I'm bringing up. So the bottom line is pretty simple. When you're building a plan to retire early, you just need to budget in $20,000 to $30,000 per year for healthcare if you're a couple retiring before 65. It's one of the biggest expenses during those gap years. And then don't underestimate it, because that's the fastest way to put pressure on your portfolio when you least want it. Mistake two is not planning income strategically to potentially qualify for the subsidies. So this is where it gets really interesting, is where most people, honestly, most financial advisors really drop the ball, is you need to understand that the Affordable Care Act provides premium tax credits, also known as subsidies, that can dramatically reduce your healthcare costs. So the catch is your eligibility is based upon your modified adjusted gross income. And so if you're ignoring that now and you're going to retire early, something to be aware of. So now through 25, we're living under enhanced subsidies that were extended by the Inflation Reduction Act. These enhanced credits eliminated what's called this little subsidy cliff. So before this change, if you earned more than like 400% of the federal poverty level, so about 58 for a single person and 78,000 for a couple, you got zero help. You paid full price. But under the current rules through 2025, there's no hard income cutoff. Instead, your premiums are capped at 8.5% of your income, no matter how much you make. So really, even if you have $2 million in the bank, if your taxable income is low enough, you qualify for substantial subsidies. So if I give you an example, let's say we have a married couple couple, both 62, 2 million in savings, you need 70,000 a year to live on. You take the easy route. You pull 70,000 from your IRAs, all's good. That's fully taxable. Your Maggie 70,000. You'll get some subsidies. You might pay 6 to 8,000 per year in premiums after the subsidies kick in. Not too bad. Take the strategic route. You pull 40,000 from your Roth IRA, which is tax-free. Doesn't count your Maggie. You pull 20 from your brokerage account as a cost basis, return of your own money, not income, and you take maybe 10,000 from your IRA to top it off. Your Maggie is just about like 10,000. And so at that income level, you could qualify for the silver plan with cost sharing reductions. Your premiums are like down to zero, and then you're talking like 3,000 to 6,000 per year in total instead of 25,000. So over these years before Medicare, now like that could add up to 60 to 80,000 you're keeping instead of like handing to the insurance company. The best part is you're living the exact same lifestyle at 70,000. You're just being smarter about where the money is coming from and how it shows on your tax return. Now, I need to be very clear about something. You can't game the system if you have no taxable income at all. So every state has a minimum income threshold. So again, there's going to be sweet spots based upon your situation, and that's where planning comes in. The earlier you start thinking about this, the better. Like ideally, at least 3 years out before you retire, you're working with an actual advisor or a tax planner to build up like Roth accounts, after-tax accounts. So you have that flexibility to control your income during those critical years between 60, 62, and 65. At the end of the day, the goal is, what's your lifestyle going to look like if you retire before 65? Do not let healthcare really be a hindrance to retiring before 65, because a lot of you that are looking at retiring earlier have probably done pretty well. Have done pretty well like saving in your retirement accounts. And so your plan would allow you to like increase withdrawals for a handful of years. But if you're 2, 3, 4, 5 years out, it might potentially make sense, especially if you're going to have like $80,000, $100,000, $200,000 of income you want to spend early in retirement, is to start showing more income and taxes now to show less income during those bridge years. And then the third mistake is really just like ignoring COBRA as a bridge solution. So let's talk about COBRA. Most people hear COBRA and like immediately think, oh, way too expensive, not even worth considering. For some, yes. For others, not so much. COBRA does have a reputation, but here's what you need to know. If your employer has 50 or more employees, federal laws requires them to offer you the option to continue your employer health plan for up to 18 months after you leave the employer. The catch is you're now paying the full premium, both the employee share and the employer share, plus up to a 2% on top of that administration fee. And so if your employer was covering 7% of your premium and you're now paying 102% of the total cost, for a couple age 62, COBRA typically is about $1,500 to $2,400 per month, depending on the plan. So that's $18,000 up to $29,000 per year. It's expensive, no question. So when does COBRA make sense? You have ongoing medical needs and you're in the middle of treatment. So imagine a hypothetical situation where maybe you're seeing some specialists. You've got a treatment plan underway, your doctors are in network and on your current employer plan. Switching to a marketplace plan in January means new deductibles, possibly different networks, and potential disruption to your care. In this case, paying for COBRA for 6 to 12 months to maintain continuity can be worth every penny. Another scenario is you're retiring mid-year and it's not open enrollment for ACA Marketplace. Marketplace plans typically only allow enrollment during open enrollment, so November through mid-January for the following year. So if you retire in March, you can't just like hop on a Marketplace plan until like next January unless you qualify for a special enrollment period. COBRA fills the gap immediately. Another scenario is your employer plan is really, really good. And some employers, especially large corporations or government entities and even union plans, offer what I call like this Cadillac coverage, low deductibles, broad networks, excellent benefits. If your employer plan has like $1,000 deductible and the comparable marketplace has a $5,000 deductible, the math might favor COBRA, at least for a while. And so if you're going to compare real numbers, you should have a general idea of how much can you afford. So again, working till 65 for healthcare is a hindrance for some, but if you're a good saver, you've got $1, $2, $3, $4 million, you're trying to retire and enjoy life. At the end of the day, if your plan supports like, hey, you can afford an extra $600, $800, $1,500 per month for a handful of years, it's probably going to make sense to pull the trigger. You just need to have an understanding of where the money is coming from. And if you are a good saver and ACA is an option, you're probably going to do earlier planning as far as like Roth conversions, Roth contributions after tax to get your $120,000 to live on, but you're actually showing like $60,000 on your tax return to qualify for the subsidies. So let's talk about this domino effect, how these mistakes potentially compound your retirement. And this is kind of what most people miss. like these healthcare mistakes don't just like cost you money, they create a domino effect that touches like everything on your financial retirement plan. So if you're 62 and you underestimate healthcare costs by 10,000, that's mistake number one. Well, now you're pulling an additional 10,000 from your traditional IRA to like cover the shortfall. Or if you're going to have Cobra, maybe you're going to pull from an HSA or Roth to pay for those expenses over the next 3 years. The kicker is from like 60, 61, 62 to 65, these might be prime Roth conversion years. This is when you should be like doing strategic Roth conversions, moving money from traditional IRAs to Roth IRAs at low tax rates, and then setting yourself up to avoid massive required minimum distributions or IRMA penalties for the rest of your life. But you can't because you're too busy plugging holes into your healthcare budget. Again, this is a domino effect. One mistake kind of leads to another. Maybe you're working longer, higher withdrawal rates, higher tax bills, reduced subsidies, working past 62. For some looks different than like working till 64. We see this a lot where people come to us 62, 63 and they're like stressed out about work or second guessing their early retirement decisions. They're really wondering if they should go back or just like retire earlier. It's not like they didn't save enough. The problem is they didn't plan for healthcare correctly. But there's like good news. All of this is avoidable. It just requires planning, not like a pie chart or let's see what the market does, like actual planning, proactive, tax efficient, healthcare aware retirement planning. Actionable framework. Questions to ask yourself 2 to 3 years before you retire early. Question 1 is what will modified adjusted gross income be each year from 62 to 65? And it's not a guess. You need to like map it out. How much will you be pulling from IRAs, from Roth IRAs, or from brokerage accounts? Are you taking Social Security at 62 or are you going to wait? Maybe you have a pension or is there rental income? Every dollar of taxable income affects your healthcare costs. Question 2, do I have enough in my Roth or after-tax accounts to control my income during the Medicare gap years? If all of your money's in pre-tax 401ks and IRAs, literally no flexibility. Every dollar you pull is taxable. But if you've done the work, you've been doing like Roth conversions or contributing to your Roth accounts, building up brokerage accounts, you have a lot of options. You can dial in your income up or down to optimize subsidies or spending. Does your former employer or current employer even offer Cobra? What does that look like compared to the private marketplace? I would call HR department before you retire, kind of get the numbers. Don't assume Cobra is too expensive or that the marketplace is always cheaper or I have to work till 65. Question 4 is like, what healthcare services do you actually use? Which providers do I want to keep? You have a specialist that you love. Check whether they're in network or in other marketplace plans. If you take expensive prescriptions, check the plans which cover them and what that might cost. If you're generally healthy, you might prioritize low premiums over low deductibles. And then the last question is, if you're working with a financial advisor, are you working with someone who actually understands healthcare and tax planning for early retirees? Not someone who talks about pie charts and just risk tolerance. Not someone who just says, well, you know what, you'll figure it out when you get there. Really need to have this healthcare plan built out into your tax plan and your withdrawal strategy so you can be doing Roth conversions or contributions. Because here's what I've learned talking and helping hundreds of households just retire early is healthcare is not a side issue. It's something you deal with now, and that way you don't have to figure it out later with your investments. It's the centerpiece of retiring before 65. Early retirement is very doable for most people, but where they get it wrong is they spend those years maybe being stressed out about work and delaying retirement or not properly planned for increased healthcare expenses. So let's look at an example here. We have a 62-year-old couple with about $2 million. Like, what should this budget look like? So let's kind of just bring this together with like looking at their numbers as the hypothetical scenario. But it's based on planning that we do with clients like every week. So we're going to say we have the Johnsons here. They're not a real couple. Just like a common situation that I see. So they're both 62, about $2 million saved, about 1.4 is in traditional 401k IRA, 400,000 in Roth, 200,000 in a brokerage account. The goal is to retire and have about $90,000 per year. Good health. They're not taking Social Security yet. They're probably going to wait till 65 or 67. But the healthcare budget we have to build for is option A, no plan, just pull from the IRA, get the 90,000 out, 90,000 Maggie, that income level. They qualify for some subsidies, but really not too much. About 12,000 per year in subsidies, add in some deductibles and co-pays. And so the annual healthcare cost is probably about 16 to 18,000. Option B, you do some strategic income planning up front. They're going to pull about 50 grand from the Roths, tax-free, doesn't count towards Maggie, 20,000 from the brokerage account as cost basis, and then 20,000 from the traditional IRA. So their taxable income's $20,000. At that income, they're going to qualify for maximum subsidies with some cost sharing reduction. So really, it's around $1,500 per year out of pocket, which kind of get their annual healthcare cost down to about $4,500 per year. That's an annual savings of almost $11,500 per year. So over the years from 62 to 65, that's going to save them about $34,500 instead of paying it to the health insurance companies. And so what happens here is you have to understand what's your situation, what's your savings, are you going to retire early? And we run into many households that are in this situation. Maybe they have $2 million, but it's all in like IRAs and 401ks. And then at the end of the day, the plan is maybe we're not just trying to find the cheapest healthcare option now, because long term, the priority is to be doing Roth conversions and then just like going on Cobra, because there's bigger tax savings on doing these Roth conversions in lower income years than there is in premium savings. And so again, you kind of have to understand like healthcare planning. You just need to know what the numbers are and what you can afford, and then what's the options. You have to be able to connect it all. And so you have to have a system that looks at income, taxes, investments, healthcare, and legacy, because you can't optimize one without looking at the others. And so my recommendation, if you're going to retire before 65 and you have $1, $2, $3, $4, $5 million, like budget annually for healthcare during the gap years, but also understand like what's your options. There's a give and a take. Like if you're going to do ACA planning, you might be giving up doing Roth conversions. Or if the priority is to do the Roth conversions, like what's that cost you in healthcare expenses, but what does this tax-free income do for you, like on Social Security and IRMA? And the key is just knowing the number and then building the strategy and the plan to support that. Because the goal is don't guess, don't hope, you have to plan. Healthcare before 65 doesn't have to be the thing that keeps you working longer than you want to. It does require a plan, like not generic advice, not a pie chart, a real like customized plan to you that factors in income, taxes, healthcare, long-term goals. That's exactly kind of what we do here for our clients. We help the 401k IRA millionaires avoid these types of tax surprises and plan for healthcare and spend more. If you're tired of generic financial advice and you want a plan that actually addresses all of this, I suggest you maybe talk to us, visit the link in the description, or at least reach out to an advisor to see if they could help you with this. And if you want to go deeper on tax planning and retirement strategies, subscribe to the YouTube channel for more information. And really the goal is to tax proof your retirement, because the healthcare doesn't have to be the barrier to early retirement. With the right plan, it's just another line item. So let's make sure you get back those years instead of working longer than you have to.